Hello, this is Stephanie Zumwalt, and I'm with Utica Park Clinic in Oklahoma. Today we're going to talk about care management toolkits. We're going to focus on pre-visit planning. So the first thing we want to know is, why do we pre-visit plan in the first place? Pre-visit planning will prompt review for risk stratification, identify trends on labs and vital signs, determine care management needs, and also determine preventative needs. So when do we do this? At least the day before the visit, but it can be done a couple of days in advance. How do we do this? We're going to do a chart review. We're going to look at the problem list, the medication list, labs and vital signs, ER and hospital utilization, trends and appointments, the last progress note, and health maintenance and preventative services. We also want to review and update the risk stratification, and if the patient is a high or very high risk, make a note to remind ourselves to follow up during and after the appointment, as well as add yourself to the care team. So let's break that down. Our problem list. What are we looking at? Well, the questions we want to ask ourselves are, how many chronic conditions does the patient have? What type of chronic conditions does the patient have? We want to take this into consideration and decide what resources that patient may need due to their condition, such as CHF, maintenance scale, a rescue pack, and care management. Malnutrition may need supplements and care management. Diabetes, a glucose monitor, referral to diabetic education, and care management. Depression or anxiety, referral to social services. Don't forget the care management. COPD, a rescue pack, and care management as well. This is just a short list of those types of conditions that may need a resource. Please be aware that there is a long list of types of conditions as well as resources that they may need. So on medications, we want to think about, do they need an aspirin? Do they need to be on a statin? Are they only on metformin and their A1C is continually above 9? Are they on high-cost medications when generics are available? Do you see that they've been having trouble filling their medications? Maybe their refills, the last time that was sent was like 3 months ago and they're only a 30-day supply. This may indicate that they need medication assistance. Latest labs and vital signs. We're looking for negative trends. This can be upward or downward trends. Are there abnormal or alarming labs? Are they due for a lab? Are there vital signs that need specific attention while they are in the office, such as a trend of having high blood pressure readings? You may want to have them wait in the room, get a little information from them, and then take their blood pressure instead of taking it as soon as we bring them back. ER and hospital utilization. How many times has the patient used the ER or had an hospitalization in the past 30, 60, or 90 days? What about in the past 6 months? What time or day did the patient go to the ER? Was it during office hours for the clinic? This can indicate a care management need. Does your EMR reflect the latest diagnosis from the hospitalization? Did your patient receive new medications while they were at the hospital? Did the patient see a specialist that they will continue to see outside of the hospital? If yes, we need to add them to the care team. Last appointment and trend of appointments. When did the patient last see their PCP? Has it been over 3 to 6 months if they have a chronic condition? How many times have they no-showed or canceled an appointment? How many specialists do they see? When is the last time the patient saw their specialist? And are these specialists added to the care team in your EMR? The last progress note. We want to read through this. We want to find out if there were other services that may have been needed to be completed before this office visit, such as labs, maybe a specialist appointment, health maintenance guidelines, and preventative services. Are there any preventative measures that the patient is due for? Can these be taken care of while they're in the office? Do they fall under a standing protocol or standing order? How do we communicate the findings of pre-visit planning? You'll want to take notes of your findings from your pre-visit planning. This can be a formal note in the EMR that the healthcare team reads prior to seeing the patient. It can be a printed form that is designed by your team, a data management system, or the electronic medical record. This can be a filled-in form that is designed by your team, such as a spreadsheet or a Word document. Any of these will work. We want to give the notes to the healthcare team prior to the patient arriving. We can also do a team huddle, either in the morning prior to any patients arriving or throughout the day as needed. So who does pre-visit planning? Pre-visit planning needs to be done by someone on the healthcare team who has clinical knowledge and can recognize the trends and upcoming needs for the patient. This can be an MA, an LPN, an RN, and a care manager. The findings should be shared with the entire healthcare team, though. Anyone who will have access to the patient needs to be aware of things that they need to be looking for.